দর্শক আপনাদের সবাইকে স্বাগত জানাচ্ছি আমাদের আজকের অনুষ্ঠানে। আমাদের আজকের অনুষ্ঠানের অতিথি প্রফেসর স্ট্যান বেকার। তিনি আমাদের সাথে যোগ দিচ্ছেন বল্টিমোর জনস হপকিন্স ইউনিভার্সিটি থেকে স্কাইপের মাধ্যমে। তিনি পপুলেশন স্টাডি নিয়ে কাজ করছেন। কথা বলছি প্রফেসর স্ট্যান বেকারের সাথে। ওয়েলকাম টু আওয়ার শো। We want to talk a bit about the expansion of the urbanization, the global urbanization, and the impact on the residents of the cities, big cities, their health issues and the challenges that they are facing today. What are the challenges, do you think, in the USA the big city residents are facing now?
Well, let me say, first of all, globally, we know United Nations gave estimates about 5 or 6 years ago. We passed 50% of people in the world living in urban areas, and we will never go back. So most people now in the world live in urban areas. That's different than cities per se. For example, where I live in Baltimore, we have Towson, we have Catonsville, places outside that can count as urban, but are not actually part of Baltimore City. But 50%, over 50% now, 52, 53% of people in the world live in urban areas. Specifically, and in developing countries, the problem is much worse than in the US in terms of very, very fast urbanization. The fastest growing cities are in Africa, and growing at such a rate that they cannot keep up with water services and sewage services and those things. And Dhaka has similar problems, growing very, very fast. Though Bangladesh is about, I think, about 85%, I'm sorry, US is 85% urban, and Bangladesh is only about 30% urban. So very different perspective from US side versus a country like Bangladesh or Nigeria, where large proportions live in rural areas. So in the cities of the US, the problems are many. One of the big problems in the city where I live, in Baltimore, is a very high crime rate, which is associated with a lot with drug crime related to securing drugs, people shooting each other to get the territory for drugs and that sort of thing. So crime is a problem, and as you mentioned, healthcare is a problem, particularly for the homeless. The Obamacare legislation is helping with that. That uninsured now is declining in the U.S., and that's overall. Even rural areas have problem with healthcare, but there are still millions of people without health insurance, and so they end up, if they have a crisis, they have to go to emergency room because they cannot pay doctors to not have a regular doctor. Is that the kind of thing you're asking, I believe, huh?
You just mentioned Obamacare, which is trying to address the problem that lower middle class or people who cannot afford health insurance. So that is being addressed to some extent by Obamacare. But you have worked in Dhaka for 3 years, from 78 till 1980. And you know the condition in Dhaka, and now Dhaka has become even bigger and more densely populated, and more people have come from outside Dhaka to work. As you might know, that garments workers, mostly women, who are now living in Dhaka. So these are causing, making the challenge even harder for the authority to address the hygiene issue and the health issue. You mentioned sewage and other things from the health point of view. So what do you think, keeping in mind the situation in the USA, a city like Baltimore, city like New York, Chicago, how can a country like Bangladesh can address the hygiene issue of the increasing population?
Well, the government has to set aside funds to build infrastructure, and this is the problem in many countries. They're not setting aside sufficient funds because if the people who are moving in cannot afford, they can't afford to put in water and sewage, then in some cities in Africa, for example, there's a truck that comes around, and this may be true in Dhaka also. A truck comes around and delivers water. So this is on the private market that people pay for that water. Now, in this country, we have city water, or we have in the rural areas, people have their own wells. But basic thing like water is a problem in many places. So in this country, it's not so much a problem, though it's becoming a problem in California, where they keep expanding lots due to immigration from Mexico and other places, population, very rapid increase in California. So they're going to have a water problem, and they already do have a problem. If you've been noticing the newspapers, they're encouraging people to take shorter showers and things like that, not to water their lawns or wash their cars, to save water, because they can't keep up. They've had a drought and there are more people, so water is a fixed resource. And until we get good desalination of ocean water, then we have to deal with the limits of water. And I'm not sure how that problem plays out in Dhaka. You have plenty of water, but fresh and clean water is a problem. I know that.
In cities like New York, thousands of people are homeless. And in other cities as well, there are homeless people. And they're causing also health risks. So how do you think the authorities can address that problem?
Well, in New York, there's I'm not sure department or what group it is that of the government that provides shelters for the homeless. Now, the homeless are many different types. I was looking this up because I don't do that much research in the U.S., but the proportion of homeless who are families now is increasing. So this is women, children, and father also usually. It's typically been just single men, and some of these single men have drug problems or alcohol problems, so mental health problems, and don't even want to go to shelter. Of course, that changes in the winter when it's very cold. Then people, even police, will take people to shelters because if they're drunk and can't walk or something, they could freeze to death. So the authorities do provide shelters in most big cities for those who are homeless. Sometimes they're full in some places, but that's a problem. New York is quite good in trying to meet the demand, if you will, for homeless shelters.
What do you see in the future? Because the urbanization will continue and the population problem will continue. What do you see in the future?
Well, it really depends on the city. Some cities are planning better than others to have low-income housing. And that's really what you need to get people off the streets and into housing. There has to be low-income housing. And that's the problem that many cities, including this one in Baltimore, they have boarded up houses. They're empty houses and somebody owns them who does not live there. And the people could not pay the rent, so kick them out, and maybe they're on the street. But the city, if the city is creative, they can take those homes, somehow get them from the owner. That's the difficult part, of course, and have people fix them up and stay there. I'm not an expert on housing things, but that's certainly, we have lots of vacant homes in this city, and yet we have lots of homeless people. So it's a matter of matching the two somehow. As I say, I'm not an expert in housing, but one can see there's plenty of housing. It's just not habitable. They're boarded up.
Professor Stan Becker, thank you so much for your time.
You're welcome.
দর্শক, এতক্ষণ কথা বলছিলাম প্রফেসর স্ট্যান বেকারের সাথে। আশা করি সাক্ষাৎকারটি আপনাদের ভালো লেগেছে। সবাই ভালো থাকুন, নিরাপদে থাকুন। আহসানুল হক, ভয়েস অব আমেরিকা।